Right now, let's talk about the NHS. Very much in the news all the time. The government's programme to build 40 new hospitals apparently has been beset by delay and indecision. Well, I'm not surprised because no one ever thought there were ever going to be 40 new hospitals. Was it Boris Johnson who made that pledge? But in 2020, the government announced the new hospital programme pledged to build 40 hospitals by 2030. 2023, they confirmed that they would prioritise rebuilding facilities. They included Raac, that reinforced autoclaved aerated concrete, which caused so many problems for schools and hospitals. But now it says NHS providers, which represent the NHS Trust, are saying the hospitals are footing the bill for delays to the project. But I don't think anyone ever believed this was really going to happen, did they? Well, let's talk about this with Dr. Bob Gill. He's an NHS GP. He's also producer of the documentary The Great NHS Heist. Good morning to you, Bob.
Good morning, Julia.
Thanks so much for joining us. Now, I mean, look, when I heard this pledge about 40 new hospitals, I thought this was a load of claptrap at the time when Boris Johnson said it. It's been proved to be ever since. And even the government has had to admit in questions in the House of Commons repeatedly over various different prime ministers, health secretaries and others, that when they say 40 new hospitals, often they just mean a new wing on a hospital or even just refurbishing an existing hospital, so not a new hospital at all. Their use of the word new isn't perhaps what you or I would mean by the word new.
Yeah, you're right. The language that they've been using has been vague and misleading. You know, to somebody like me, building new NHS bed capacity would be fantastic. We have experienced over the last few decades a contraction in bed capacity by more than half. We have per head of population one of the fewest bed numbers in Europe. You know, Germany, for example, has 3 times as many inpatient beds as the NHS has. So we could do with extra capacity, but these promises are often not genuine, electioneering promises perhaps. And you're right, they were describing extensions and refurbs as new hospitals, which is completely ludicrous.
Yeah, and it's a lie. I think the voters aren't going to be fooled by this. They know whether there's a new hospital in their area or not, don't they? Now I understand one of the reasons why we saw the cut in the number of beds was, you know, people having keyhole surgery, people not expected to stay in hospital as long as they were. But we do, as you say, we have one of the lowest per head of population number of beds in this country compared to pretty much any other healthcare service. What I find fascinating, though, is many people are, very much in favour of, people, the NHS. In a bizarre situation, though, often talking about much better health services elsewhere. Well, in Germany, they have a sort of a social insurance scheme. They don't have a complete sort of one-stop shop, big monolith national health service paid for out of tax. Maybe that's the solution, not having the system of healthcare that we have.
Yeah, so if you look at key work done by Professor of Economics Kenneth Arrow back in the 1960s, he compared health systems across the world and decided that a tax-funded system is the most efficient way to deliver because you don't need a separate parallel bureaucracy, duplication of effort and complexity.
That totally makes sense, except, of course, we do end up with a huge bureaucracy and we do see better outcomes. The NHS, very efficient at spending our money. The trouble is, the one thing they're not very good at is keeping people alive. We've got some of the lowest survival rates for cancer, heart disease, diabetes and pretty much everything else in the Western world.
So, yeah, I'm not disagreeing with you that performance of the NHS has rapidly declined over the past decade. But by coincidence, the relative funding to the NHS has remained pretty low compared to historical figures, 4% since 1948. Then over the last decade with austerity hovering around the 1% mark.
But huge amounts in the last few years. By the way, their figures haven't got worse in the last 10 years, a lot of those outcomes. They've improved. They're just still well behind other countries who have a different health system and different funding of their health systems. And yet so many people sort of cheer on saying, oh, it's the NHS, it's the envy of the world. No other country has copied our system for a reason. They have better outcomes in other countries. They don't necessarily spend more in other countries, but they get better outcomes. Maybe we need to have a bit more of an honest, sensible, reasoned debate about our NHS instead of...
I agree, honesty is key. In terms of copying the system, Scandinavia copied the beverage system, Spain, Saudi Arabia, Israel copied the NHS system.
They don't have systems like that now. They don't. This system in France is completely different.
Okay, I didn't. I corrected France. America has an NHS-style system for veterans, which works very well. The problem is there's a corporate power grab in terms of transitioning our systems into an American-style system.
No. I mean, there are what? How many countries? What, 180 countries in the world? It's absolutely extraordinary. Everyone who wants to defend the NHS always says, "Oh, we don't want an American-style system." Even Americans don't want an American-style system if they know anything about it. The vast majority of the Western world doesn't have either an American system or the British system. Maybe we should do what the vast majority of the Western world that has better outcomes than us do, but also not lying about building 40 new hospitals.
Okay, but, let me finish my point, Julia. What we've seen over the past 4 decades, which I outline in my film in great detail, is legislative creep, which has replicated the American system, right? Who has been leading the NHS for 7 years, from 2014 to 2021, a guy called Mr. Simon Stevens, who was hired from the American
private sector,
giant United Health. We have now legislation in place in July 2022, which has created something resembling managed care HMO units. So the NHS in England now is 42 separate public-private partnerships, which will be allowed to control their budgets. The NHS does not exist in the form that Beveridge designed. You're right, we have a very bloated bureaucracy which is required to run this market. But people are not aware because you have the NHS logo and people aren't aware.
People don't realise. But again, also GPs, the people we most have contact with, they're actually, private contractors, are they not? Well, there's also this scheme we're told about, plans to expand the number of places that patients will be able to get care out of hospital has been hailed as the largest expansion of choice in the NHS in a decade by the Prime Minister. New trials set up to see whether patients in need of things like hearing aids, other diagnostic tests and things will benefit from being offered a choice. People want choice because they want to be able to choose where it's working best, where there's the shortest waiting list. Look, in most other Western countries, there aren't waiting lists for things. People don't care where they go to the local place because the service is so good everywhere. We need to be offering choice. Choice in the market is how you deliver better outcomes in virtually every other field.
No, so choice is the privatisation lobbies for more privatisation. That's their talking point. When you are seriously sick, having a heart attack, you're hardly in a position to be choosing your cardiologist.
No, that's why we have that social care. But again, how come though, if you've got the social insurance schemes in countries like France and Germany and most of Europe and Canada and Australia and everywhere else, how come they've got a better chance of surviving? They've got cancer or if they have a heart attack than they do in the UK. If our system's so great, well, the facts don't lie.
The point I'm making is the NHS has been. We have now an engineered crisis, lack of capacity. Up to 8 million people languishing on waiting lists, right? That all has a knock-on effect on outcome. Now, if you look at things outside of the control of the NHS, like smoking habits, drinking, obesity, you can't blame the health service for the health and the chronic conditions the patients are developing, right?
Yeah.
So you need to look at system as a whole, society as a whole.
Yeah, that's true. Can I ask you, just finally,
advertise junk food to children? Or do we feed them decent food, right?
Well, so I would say that's up to parents. I think it's up to parents to do their job properly. I feel very strongly about that one, but it's not about banning junk food. It's about parents doing their job. I really want to ask you really, really briefly, this study that they're paying basically up to £400 to men who are obese to lose, it's only a little bit of weight, but they found that actually motivated men to lose weight more than just being given encouragement or information. Do you think that's a good use of NHS resources in that trial?
I think it's to make a decision based on one study is irresponsible.
Okay.
I'd like to see more detail on that. I think it's not a very good example to be setting in terms of financial incentives to look after your own health. And then you've got to wonder, where is this money actually going to end up?
Spending it on junk food. Yeah. Bob, really have to leave it there. But thank you so much for joining us, Dr. Bob Gill. He's an NHS GP and also producer of the documentary The Great NHS Heist.